This is a raised squat to a bench or a chair or the bed. This is a useful exercise to regain the squatting pattern movement, especially after hip surgery. Once you've gone through your first 6 weeks working on mini squats, this could be a useful progression using a bench or a chair or the couch. If you have any mats or pillows, you can raise the height so that you can start with a shoulder width stance, feet either straight or very slightly turned out. You can then squat back to sit down on that bench and then stand up. Make sure whichever stance you use, the knees must point in line with the toes, and you can vary the width of the stance depending on the comfort in the hip. If any stance width causes pain in the hip, vary the stance to find a pain-free range of motion. The goal is to sit back towards the bench whilst keeping the chest lifted, so you can either reach with the arms or cross the arms, or if you really need to, for confidence, you can use the hands on the bench in the early stages. The goal is to sit back slowly to the bench, sit down fully, and then stand up. The progression would be to sit back and lightly touch the bench and stand up. That way you're not resting as much weight on the bench in between each rep. And as these feel easier, take one mat or pillow away so it allows you to use gradually a greater range of motion. With this, it's important to make sure that you follow your physio's advice to make sure that you're ready to use greater ranges of motion in your squat, and to listen to your body. And if you experience pain, make the exercise easier or change the stance foot placement. So a lower mat will allow you to go deeper into the squat. And then eventually the progression would be to take the mats away and start to work deeper into that hip flexed position. You could vary the stances to see how that feels on the legs. But a good option is to use a comfortably wide stance, somewhere around shoulder width, so that it allows you to get a little bit more mobility expressed through the hips. When you're squatting, make sure that your back stays in a neutral spine position. So that means that as you come down, we maintain a very slight lumbar curve. So imagine you're looking forwards into the mirror, keeping your chest up, and don't allow your back to round. Try to keep that chest up position. Again, anywhere around 2 to 3 sets of about 10 to 15 reps. But make sure you check this through with your physio or your orthopedic surgeon first.